Very good evening, Rupesh. So today we are going to present our social cause webinar, and it is on Pilates mystical multifidus. I'm very happy to announce that our today's resource person is our team member. He is a Pilates expert and co-founder of ExRxIndia as well. uh, for organizing this session. As it is a social cause webinar, our dearest participants have donated as much they can. And Rupesh, I would like to request you that I will be showing our participants who have donated. Kindly stop the screen share. I will be sharing the screen and showing the participants who have donated for our program. And ExRx India pays respect to all the participants who have shared. Rupesh, is my screen visible?
It started to share, yeah, ma'am.
Okay, here is the list of participants who have donated for this social cause webinar. I hope you can see the names and the amount we have received from this program will be donated to baby Mitra for her medical expenses, and we have collected almost 10,000 rupees. You can see the value. And now I am going to stop screen sharing, and Rupesh, you can start the screen and start our program. I would like to request you to start to this session. Thank you.
Yeah, ma'am. Good evening, everyone, and I'm happy to take this session on behalf of ExRx India for social cause. So this amount is going to be given to Baby Mitra for SME. So all the participants who have donated or who have big hearts to share amounts are welcomed with this session. So now we'll go into the session. Yeah. Now coming to the session, why I have chosen Multifidus, because it is one of the major and important session for our low back issues. So for example, many of the population are sitting for long duration in recent times. For example, now during lockdowns and during work from homes, they are sitting for a long time and they are being more prone to low back pains, and they are not even concentrating the activation of those muscles. So those muscles are the major muscles which are giving stability to your spinal cord. So those stability which is lacking, giving the immobility to their spine and giving other issues. So for example, SA joint dysfunctions or pelvic floor dysfunctions or any other breathing difficulties or anything is being correlated with your back or deep muscles of your back. So how I came to know about this is like something with a single case study. So once this connection is being noticed or identified, then there will be more of clearance of your diagnosis. So first we'll go with it, then we'll clear the differential diagnosis, and then we'll go with the provisional diagnosis. So in that way, when I discovered it first, the light bulbs of it, in the sense there was big changes in the practice of physiotherapy in the clinics. So when this Pilates is being announced, you are going to go for, sorry, I got muted. So when this Pilates is going to go for, give you a greatest change. So this greatest change is going to give you more value to your profession as well as your practice. So this practice is going to give more clients and more results. So this results will create more changes in your correction of your body or posture. So in fact, when the multifidus connection, when I credited with the gaining 2 inches of height, that is, for example, when you start strengthening your multifidus muscle or start giving back muscle strengthening, what happens, automatically you become stable, that is stabilized. So automatically your spinal joints get stabilized and you are going to get lengthened of your height. For example, you feel tall, so that is what is mentioned here. So with gaining of 2 inches of height, so it might be due to any other issues or due to my SA joint dysfunction, or it might be due to some pelvic floor muscle activations or inactivations or hip flexor inactivations. Altogether you need to find out and then you need to correlate it with your other musculatures. So not only your multifidus, even if your side obliques or your deep muscles of your core are to be assessed when you are starting your diagnosis. So in this session, we are going to go only about the overview of how we are going to find or how we are going to differentiate or correlate it with the deep musculatures. So from there, we are going to give exercises or therapy or whatever it is. So from this therapy or from these exercises, we need to find the difference what you have never felt before. So when you are never felt before, now when you are never felt the difference before, automatically the changes in your pain or changes in your postural discomforts will be progressed at a sudden. So from that sudden way, you are going to feel the changes that is actually possible with the Pilates type of exercises. So again, Pilates is not only your core exercises or core strengthening, it is also helpful for other things. For example, for your low back or for your shoulder pains or for your knee pains, whatever it is, you need to diagnose it correctly, then you need to assess wisely, and then you need to put it on a perfect exercise therapy plan. So in this image, you can see the muscle which is starting from the cervical and it is ending on the pelvic bone. So it is the one of continuous muscle which is giving you stability to your spine. So this stability is going to create more of. Next we will go to the postural change, that is your neck. Previously what I said, it is starting from cervical. So even when your neck posture is changed, you are going to find the difference of your low back. So when you are tall and standing upright, definitely the arches in your spinal curvatures are going to be falling correctly. If not, you are going to go for kyphotic posture or irregular in postures, and this posture is going to give you imbalances or cross syndromes on your regular musculatures. So these musculatures are going to give you more of instability to your back. For example, when you are treating your low back pain, if you are missing out few assessments, for example, your lower body strength or your lower body muscle tightness or your core muscle weakness, anything can cause you the pain. So if you're not finding any corrections between that, you need to feel it right way to imagine as if this pain is for self. So you need to feel that pain and then you need to find the correct musculature or correct differences what you are going to face it. So always the multifidus and your transverse abdominis or work as a team. For example, transverse abdominis was on your horizontal core, which is going to give you stability to your low back area or low back muscles and bones. So from there, your deep abdominals are going to work. So here also it is of deep muscles. So deep muscles and superficial muscles always has to work with maximum efficiency to give you correct progressions. So if you are finding your multifidus, then it is a good sign that you are going to give connection to your back. So when your back is being connected with your multifidus and you find that difference or you find out that multifidus is the main cause of this pain, then the assessment becomes easier and the progression of your pain is earlier. Earlier in the sense you can treat it easily and you can give wise results immediately. So when you are giving results, automatically the client base is going to get improvised and the confidence on your client or confidence by your client on you is going to progress. So when you have never felt your multifidus before, then there is difference in feeling of your muscle contractions. So it is a deep muscle, so it is definitely little difficult to find the muscle. So when you need to find this muscle, you need to find the correct or exact pose of your muscle, then only you can find the feeling of your muscle. So always or usually this muscle swells in a good way. For example, if you're strengthening your multifidus, there will be a bulge in your paraspinal areas or a muscle to your left and right of the transverse or transverse process of your spine. So when you hug your spine, then it is going to give stability or they are going to get engaged. When it is engaged, automatically your muscle contractions are happening. When your muscle contractions are happening, automatically your pain or other formations, for example postural changes or any other things, are going to get corrected. So this correction gives you more remedies to your low back aches. So there is many say that strengthen your core, get lost of your low back ache. So it is more or less kind of same thing. Even if you're strengthening your core and your low back pain is not going, then you need to target the deep muscles of your back, that is your multifidus especially. So all of you can close your eyes and just feel your multifidus, then it really responds well. For example, close your eyes and then sit upright and just try to maintain your pelvic tilt. That is, you need to tilt your pelvis into your posterior and anterior tilt, and then you need to find the between movement of that range. So from that range, you can find the multifidus. So it is an imaginary process. You need to find or you need to feel the muscle which has been passing over there. So even if you're not feeling anything, using this imaginary technique will give you greater results. So your muscles automatically, that is your motor response, what you are taking through your imaginations, are going to give you great results. So always, even for your bicep strengthening, you are giving bicep curls or elbow flexions. If you are not able to find the difference or if you are not able to do that movement, think of doing that movement by closing your eyes and give you 100% with your normal deep breathe in and out. Then definitely your muscle is going to get activated. It will not build or bulk up your muscle, but definitely it is going to give you results like activating your biceps or your imaginary muscles, what you are going to achieve. So this imagination is going to give more of results. So this result is going to give you the correction of your postures. So give this a try and let me know how it goes. For example, now everyone are in sitting, lying or standing or doing some of the other works. So everyone can close your eyes and just think that you are going to activate your multifidus. So I hope everyone know where is your multifidus. So I'm showing you the first slide, that is the picture of the multifidus. So you can look at this muscle and you can find the muscle. So now I want everyone to imagine or feel yourself and just text what you felt in the chat box. So I'm waiting for your replies in the chat box. The feeling of your muscles has to be felt. If not, that also you can text in the chat box. YouTube participants can text what you are feeling in the YouTube chat box.
Participants, you can please reply in Zoom chat box, and YouTube viewers, please post your feeling in YouTube live chat box.
Yeah, thank you, ma'am.
If you are not feeling anything, then too. Okay. We have received 2 replies from Zoom. Akhil
Yeah,
is saying 2 rod-like
that,
ball on both sides. Rupesh, can you read the chat box?
yeah, ma'am. Yeah, ma'am. Zoom chat box, I can visit it, ma'am.
Okay, okay.
Madhuri K's session is not yet over. I have asked a question in between the session. So Don't give credits at the beginning of the session.
Okay, there is a reply in YouTube.
Yeah, feel
Uh,
relaxed.
Pankaj Behra says, I feel. Shataru Umar Aliu says, a sense of stretch. Deepak Padik says, I feel.
Yeah, Dr. Charusmita. It is exactly from the lateral spinous process. I feel stretch felt on sides of spine. Good. Yeah, definitely you'll be feeling something. For example, someone told that there is a bundle or bulb. You felt a stretch. You felt something is stretching. So these all are going to give you the activations of your deeper muscles. So you cannot easily achieve deeper muscles with easiest way. So only the easiest way is feeling or imagining that you are going to activate it or you are going to feel it. So usually for activating the deep muscles, we go with single leg bridging with heels on the high chair or high bench. Then you activate it with bridging or any other activities. So the process is little bigger. For achieving it easily and calmly, you can use the feeling technique, that is imagination. So from this imagination, you can get much more better results. So for example, few clients with acute pain, they will be like, I'm not able to do exercises. So for them, you can use this technique to get better results. That result, even it may be 10%, that 10% is also the change you are going to give to your client. So 0 is better than 10. So you can follow these techniques for those who are 0. So in what are all the activities or in what are all the dynamic ways your multifidus is going to get activated? For example, multifidus is in breathing. For example, when you're sitting or lying, you can go deep breathe in and out. Automatically your multifidus gets activated. Then in sedentary life, it is like sitting, standing, walking, whatever it is. Like whenever you are sitting, standing, walking, you are going to do breathing. And even in sitting, in certain positions, for example, sitting upright is going to activate your deep multifidus. Standing upright and standing stiff is going to give activations to your multifidus. Next, for sportsmen, these muscles plays a major role, especially for those who are running or those who are with low body sport. These multifidus activations are going to play a wonderful role. For someone with upper body sport or overhead activity, this multifidus gives you minimal change or minimal activations of your spine. So usually someone in cricket, a fast bowler, is going to get more prone of back pain. So this back pain is going to create more changes. So this changes is going to create changes with activation of your musculatures. So this musculatures is going to give corrections in your postures automatically. While you are bowling, your biomechanics gets in that way where your stress and strain is going to distributed. So this distribution of your, the best position to activate your multifidus is sitting or in lying position. So when you are lying down or when you are in sitting position, if you're standing or in your walking, it is not going to feel that much. But in your sitting or in your lying position, this is going to give you wonderful change. This wonderful change is going to create great wonders, as we discussed earlier. So in sitting, how you are going to feel? Like you felt in your previous slide. I have asked everyone to give a try and let me know how it goes. In the same way, if you feel it, you are going to find the difference of your postures. So this thing can give from relaxation to stretching to strengthening to building up of your musculatures. So this building up is going to create more wonders. Now coming into Pilates, I want to know what is Pilates. So anyone can text it in the chat box, what is Pilates. So I'm going to just give outline of Pilates and I'm not going to go deep about Pilates. And even those who are watching in YouTube and in Zoom, while asking questions, that questions can be of what to say in the beginner levels. So those questions will be answered and the doubts will be clarified. The deeper questions needs the deeper sessions. So overview of Pilates is just simple concepts of how you are going to apply it in your regular practice. So anything related to that you can ask in this session. Now I want to know what is Pilates. You can
The
text in the chat
participants,
box.
you can respond. YouTube participants too can post your answers in live chat box. Just what is your concept about Pilates? What you know? What is it? You can answer in short. There is an answer. Marimuthu B says core muscle strengthening.
Yeah, ma'am. It's a kind of strengthening flexibility form of exercise which involves breathing in a controlled form from Dr. Charles Smita. From Asphia, it is type of exercise that improve flexibility and muscular strength. From Jayasuda, improve flexibility. Good. So Pilates is,
Chitra Swaminathan in YouTube says core muscle strengthening exercises.
yeah. As I told before, Pilates is not only for your core muscles, even it works or helps in your upper body or in your lower body issues also. So definitely Pilates is not only for core, it is also for core. And others have texted like it's for flexibility, it's for strengthening. So flexibility and strengthening, it's acceptable.
Muscle activation technique.
uh,
There is a message in YouTube. It concentrates on postural alignment by core strengthening, says Ravali Rao in YouTube. Dear participants, kindly wait for a minute. Our resource person will join back soon. Dr. Komal says improving muscle control and core strengthening. In YouTube, Vaishnavi am saying low impact exercises aims to muscle strengthen. Mahesh says physical fitness system of the PA. Whoever joined with us in Zoom as well as in our YouTube channel, I would like to inform you all guys that this is a social cause program and ExRx India thanks everyone who have donated for it.
yeah,
I
I
think our resource
uploaded
person has
correctly.
joined back. Rupesh, can you carry on?
Yeah, ma'am. Yeah, ma'am. So I've got few and many more answers in the
Please carry on.
chat box. So Pilates is not only for whatever we got the answers. Pilates is even for the plyometrics, even for our cardiac endurance, even for maintaining the body weight and maintaining the tone of our musculatures. So Pilates is not specific. Pilates is having wide range of benefits and wide range of scope in the practice. So now Pilates is just like what we saw before. It is a mind-body coordination exercises. So when your mind and body is coordinating, automatically you are going to optimize your physical fitness. When your physical fitness is optimizing, it is going to give more changes at every level of your physical abilities. So this was been what is it identified by Joseph Pilates in the year 1980 and 1967 during the World War One. For example, during World War One, there were many of soldiers who got injured and they were not able to move their limbs. So at the time, he was not able to find a perfect gym or perfect rehab center. So wherever he was in the war area, he found some springs or some what is a resistive devices, and he found on his own of his techniques is known as Pilates. So in Pilates we have few principles. We are going to see that also in our future slides. So using those principles only, we have formulated these series of exercises. These series of exercises are going to give more innovations. So these innovations in the newer trends, for example, at present they have many changes in the Pilates like reformers, cardiac, barrel, arc and barrel, and many more. So these equipments are going to play a major role in the field of Pilates. So these Pilates is going to give more in the field of sports. For example, it is going to prevent your injuries. So this field and this injury prevention is going to give you a long-term maintenance of your musculatures. So these musculatures are going to give you the postural coordination. This coordination is in turn gives you the results. So many other principles have been formulated or reformulated in recent era. So these modern principles of exercise science have been following at present. So this presentation is going to be on the facial fitness also, because fascia also plays a major role. Fascia release is not what to say. It is not a technique which are going to release the fascia with the manual therapy. You can even mobilize fascia with your exercises and stretches. So with Pilates, you can stretch or elongate your body. Few of them have replied in the chat box that they felt a stretch when you felt doing that activity. So when you are stretching that activity, you are going to find the results. So it is one of the safest and more effective methods to follow. For example, stressless and stress-free activities you are going to do in the Pilates. So this Pilates is going to give more and more changes to your clients. So there is more than 500 controlled and low impact exercises to engage the mind and total conditioning of your body. Total conditioning is nothing but reconditioning your muscles. For example, you are going to overdo your muscles, you are going to give rest for next 2 or 3 days. So while doing Pilates, there doesn't need any rest in your consecutive days. So wisely, you can do Pilates exercise for every alternate days or weekly 3 sessions. So which gives best of its results. So it works for wide range of people. For example, in rehab setups, in prenatal clients, that is women's health, and in athletes, that is sports physiotherapy, and then for celebrities and everyone in between. Why celebrities? I mentioned because for maintaining zero tone of your body or zero shape of your body, this Pilates plays a greater role. For example, someone who is lean cannot lift heavy weights. To improve their strength or improve their muscle mass, they can follow Pilates and maintain their muscle and body shape. So this helps for both men and women and at all ages of life. So this improves the optimal strength and flexibility, endurance and posture as we discussed, without building bulk or stressing the joint. For example, someone with 50 kgs can strengthen their muscles at 50 kgs. Someone with 100 kgs can strengthen their muscles at 100 kgs. So these strengthening doesn't, this training is going to give more conditioning to your core as well as rebalances your muscles. For example, some changes in your body is going to rebalanced with the form of Pilates exercises. So Pilates is what is it? A newer form of technique or newer form of exercise that you can do it on a equipment or on a mat that is on the floor. It gives best of its results on everything, not specific to mat or not specific to specialized equipment. So wherever you're incorporating the Pilates, you are going to give best of the exercise results. So this exercise is having lot of evidences and lot of what is it results over past 5 6 years. So these results are giving us more confidence of our clients. So this confidence is going to progress the field of exercise science. So now coming to the five basic principles. Five basic principles, I'm just going to name those principles, but I'm not going to explain those principles, because explaining each and every principle is the main technique to what is it incorporate in the field of Pilates. So this incorporation is going to give you the results. So for that you need to be certified, or for that you need to be efficient enough to teach or instruct your clients to follow Pilates. So this is, for example, a short time webinar where you cannot learn the complete Pilates, where you are going to get the outline of Pilates, what you are going to follow it in your minimal practice, not your wide practice. So this wide scope of practice needs definitely a big certification, that is 2 or 3 day Pilates course. So those knowledge are going to give you the major effects or your practice. Here you are going to get the outline of this Pilates. So even with this outline you can get best of your results. So now coming to principles of Pilates, we are going to see the Pilates of exercise therapy also. Exercise therapy is nothing but a normal or generalized exercise therapy. For example, someone with joint immobility, you cannot give 100% of your exercise. So for that, you need joint mobility and stability, then the strength and flexibility, muscular coordination. So Pilates involves the following biomechanical principles. What are the five principles in Pilates is breathing, pelvic placement, rib cage placement, scapular movement and stabilization, head and cervical placement. So the outline of these five principles are the main and utmost in your field of Pilates teaching. So, as we discussed earlier, again I'm repeating this. This is a mind-body coordination or mind-body awareness, which ensures focus on precision and control in any Pilates program. Precision and control means you need to be precise in your activity or in your teaching, and you need to get control of your movement. Then only you can give 100% with your Pilates. Now, coming to the first principle, that is breathing. This breathing promotes effective oxygenation, which is focused and avoids unnecessary tension on your musculatures. So particularly in your neck, shoulders and mid back. For example, the accessory muscles are around your neck, shoulders and your mid back. When you're not activating your accessory muscles, definitely you are going to give deep changes of your postural corrections. Exhaling deeply activates your deep support muscles. Usually, you can try this. Exhale out, that is, blow out your air completely out through of your lungs. Then it definitely activates your deep supporting muscles. And always in breathing, it is a three-dimensional breathing pattern, and you are going to expand your rib cage in all four directions or in all 360-degree. When you are expanding it all 360-degree, you are going to improve the strength of your rib cage or your thoracic wall. So automatically your breathing muscles are going to get incorporated in the strength. During exhalation, that is, you are blowing out your air, you need to flex your spine. During inhalation, that is, you are intaking your air inside your lungs, you need to facilitate your spinal extension. So this has been one of the biggest points. So this breathing, I have given all the important points what you need to see or look at your clients when you're instructing your client to do Pilates. So when you're taking your deep breath in, you need to facilitate spinal extension. When you're exhaling out air, you are going to facilitate your spinal flexion. So this spinal flexion is going to give changes with your other activities, that is strengthening. So this strengthening is going to, again as I say, help in your postural corrections. Next, coming to your pelvic placement, we have main role with your pelvis, that is control and stabilization. So this control and stabilization is going to be helpful in your upper extremity as well as in your lower extremity. So that's why even for your lower limb injuries, these are going to give you the greater changes. So these reduces the minor errors, that is your anterior and posterior tilts are greater things which gives force on your spinal curvatures. So these minor errors are being corrected with the pelvic placement. Then what is optimal alignment? For that you need to go for assessment. So assessment of Pilates is something different. There you are going to find the assessment, and then this assessment you are going to change this optimal alignment. Then there will be good coordination, that is coordination is something, but when you are moving your lower body there won't be any stress on your mid back or low back, so automatically you are going to control it with good coordination. Next is your balance. Balance is something like proprioceptive feel. For example, in Pilates we have challenges to be faced, that is you need to put your weight, body weight on your toes, or you need to move your ankles in plantar flexed or dorsiflexed ways, so that your feel on your foot is going to get improvised even with this exercise activities. So this balance and motor patterns are going to give more changes in your body structures. So next is your motor patterns. So what is motor patterns is nothing but your reflexes from your peripheral to next, going to your ribcage placement, that is our third principle. The exact manner of execution of this ribcage placement is nothing but it is going to give more and more of 360-degree of breathing. So this 360-degree of breathing is going to plays a major execution in your activation of your Pilates activity. And this is a key principle. That is, this is one of the mid between. So out of five, third one is the between principle. So it is a key principle. This reduces the confusion and compensations of your accessory movements. Next, coming to your scapular movement and stabilization, it's your fourth. It is like upper body core, which is on your thoracic. So this stabilizes scapula on the rib cage, and it is important as contracting the abdominal muscles during the initiation of every exercise in your flow. So this is going to play a major role in your each and every activity. So this activity is going to give more stability to your upper body. So this upper body activity is going to give more stabilization to your upper body spine, and then it is going to give corrections to your posture. So when it is smooth and uninterrupted, there will be continuing of movement. So when your movements are continuing, automatically the stress and strain on your upper body is going to reduce, and your feel good activity is going to felt. This felt, that is feel good posture or feeling of other activity, is going to get in a greater manner. Next, coming to your head and cervical placement, which is your final principle. This cervical spine should hold its natural curve with the skull balancing directly above the shoulders when sitting in neutral. For example, in your upright posture, you are going to feel it. So it is going to put your weight from your cervical to thoracic, from thoracic to lumbar, and then from lumbar to your lower spine, that is your sacrum. So all this stress has to be followed. So this following of the stress or what is it, gravitational forces on your spine is going to give impact. So this impacts has to be reduced. For that, there will be increased concentration of your muscles and it gets activated, and then attention of your body is going to get improvised. Then you are going to fix to a single objective. Single objective is nothing but you are going to find the proper curvatures of your spine. uh, 1 second, yeah. Now I want everyone to just put a word on what we need from Pilates. So if you text in the chat box, then we can proceed it. What we need from Pilates. So this is just an introduction session. So it will be like most of things will be covered in our future modules. So participants from YouTube can text in the YouTube chat box, and from Zoom they can text in the Zoom chat box.
Rupesh, can you elaborate the question once again? There is a request from
Yeah,
participant.
what we need from Pilates. For example, on performing Pilates, what we expect from the clients or what we expect from instructor.
There is a response. Jaya Sudha madam is saying that it improves stamina, strengthen the muscle. It's in Zoom chat box.
Yes, ma'am.
In YouTube, there is a message that it's posture correction.
Great to know. So now we look what we need from Pilates. So as many said, Pilates is like core strengthening. Definitely, core is the cornerstone in the rehabs. Cornerstone in the sense it's the main. So this core strengthening is achieved on performing Pilates. Next, motor relearning strategies. For example, it is called as mind body coordination exercises. So when you are coordinating your mind and body together, automatically it coordinates your relearning strategies. So these relearning strategies are going to create more and more of impacts. So these impact is going to create the attachments to your superior sensories. Next is your muscle and movement. So definitely it facilitates your muscles and improves your movement pattern, that is your biomechanics corrections. So this efficiency creates greater results in your postural changes. Next, stable central platform, that is again your core, which is stable, then your body is going to give the greater stability to your body. Next, deep and globular muscular system. As we discussing, this session is only with your deep musculature, that is your multifidus. Definitely your deep and globular muscular system. Globular in the sense, all the muscular system and even your the end of your muscles are going to get activated. The tip of your muscles are going to get activated. Every part of your muscle is going to get activated. So that's why it's deep and globular muscular system. Next, what it gives. In turn, what it gives. In turn, it is a tool, just a tool. For example, I am not saying Pilates is everyone has to follow only Pilates. It is not like that. It is just a tool. You need to use it wisely, where to give, when to give, how to give, to whom to give. So you need to assess a client and then you need to find out the errors and then you need to incorporate the exercise signs or exercise tools. It targets and controls the specifics of your dysfunctions. So these dysfunctions are going to create greater changes in your postural corrections. Then it's problem solving capacities for identifying cause for pain. For example, someone with chronic low back pain doesn't get any remedies. So for such clients, this plays a greater role. Then this recognizes and train and assess the muscle to work in a coordinated way. So this coordination gives major results in the progression of the health science. So body science and everything is going to be with the relearning strategies. So this coordinates in such a way where you are training and finding the whatever you are going to assess. So this can make your client to perform functional exercise with pain inhibiting pathology. So it is a type of relaxation exercise where you are going to feel the stretches like flexibility and everything. You can make a client to do the exercise oriented pain relief technique. So what are the take home points from this session are stabilization and mobilization, that is you are stabilizing your spine and mobilizing your joints. Then it's client centric, not problem centric. You need to get the assessment for what your client, not a problem centric. For example, a person comes with your low back pain, you are not going to treat that low back pain. You are going to find from your assessment, and then you are going to treat your client. Begin to sense the multifidus, that is feel of your deeper muscles. Here multifidus is deep, so that's why we call it as mystical multifidus. So where your deeper muscles are going to get incorporated, that you are going to feel it. So this feeling of your musculature is going to do much more wonders again. Then the pattern of movement. Pattern of movement is nothing but whenever you are moving your patterns, or whenever you are moving your body or biomechanics in the sports or in any other field, those patterns are going to relearned by your brain. So this relearning is going to get in a corrected pattern. Next is core and Pilates. As everyone said, it is again core. So that's why I said core and Pilates. Pilates is not only for core, Pilates is for all. So it is for everything. So it is going to give greater changes of your. So I have taken the information from this case study. So with this, if you have any questions, you can raise your questions in the chat box. Zoom participants can raise your questions in the Zoom, and YouTube participants can raise your questions in the YouTube. Duna ma'am, I'm just checking out.
Yes, I am here. There is a hello.
Yeah, ma'am. Yeah, ma'am.
There is a question in YouTube already. I'm posting it for you here in Zoom chat box. Kindly check.
No, I will open Zoom, ma'am. How to activate?
It's not in Zoom. It's in YouTube. I am pasting in Zoom.
Yeah, I'm opened YouTube also, ma'am.
Okay. This question is from Chitra Swaminathan. How to activate multifidus in sitting and lying?
Yeah. How to activate is you need to feel where your muscle is first. For example, in the first slide, I have shown the picture of your multifidus. So you need to feel the musculature or pattern of your muscles or your muscle cores, and from there you are going to activate your multifidus, that is in an isometric way. So this isometric way you are going to find the activations in sitting, lying, standing, driving, or whatever way you are going to do. Next question is from Dr. Charu Smita. Can we start Pilates in acute low back pain case? Definitely. Pilates is one of the low intensity exercises you can start in an acute case. For example, someone with pain scale 7 or 8, you can definitely go with Pilates. Someone with 10, definitely give some relaxation before starting Pilates. Someone with 7 or 8, those are accepting the pain scale, then you can definitely start Pilates on the day 1 or day 2 of their visit to your client. Next question is from Prerna Chandrasekhar. Does Pilates work better as a standalone therapy on in combination? You can state any research evidence for the same, please. See, Pilates definitely will not work as standalone therapy. Pilates is one of the exercise routine. So it is one of the tool to activate your musculatures. That is, you're strengthening your muscles. So definitely not a standalone therapy. It is a one of the two. So as we discussed earlier, or like here I've told, it's just a tool. What it gives, it is just a tool. So you cannot definitely depend on Pilates completely, but you can give a wonders using Pilates. That's all. So research evidences are there with what is it, strengthening for one group and Pilates for one group. So definitely it will give you changes with your. Next is from YouTube. Shruti Chowdhury say, could you please suggest a good book for Pilates? So there are different schools of Pilates. So first you need to find which is the best school of teaching Pilates. So usually Start Pilates is one of the best and well-known school of teaching Pilates. So that is the best book. I say Start Pilates is the one of the best books and materials which I have gone through, and many of them follow different books. Like what to say, there is some schools. I don't want to mention the name of the schools. So those schools of Pilates also gives you the more or less same kind of principles what you are going to follow. Yeah, thank you, ma'am. From Miss Lakshmi TS, can we do Pilates for diastasis recti? Definitely yes. Pilates is the, for example, previous question like I have got it's like whether Pilates is like standalone therapy. For diastasis recti, definitely it plays a major role. For example, diastasis recti is something like increased in space of your rectus abdominis muscle. So it is for your muscle. So when you are strengthening your muscle, definitely it is going to get corrected, and then this Pilates is going to give you wonders in reducing the diastasis recti. From Dr. Akhil, sir, by tucking in abdominal muscle, can we activate multifidus? Not only with tucking in abdominal will activate your abdominals or your deep core. For activating multifidus, you need to tuck in your abdominals. You can, with the tucking of your abdominals, you need to tilt your pelvis completely to your anterior and completely to your posterior, and then you need to find in between movement. That is, you move your pelvis completely to anterior tilt and posterior tilt, and between movement you are going to find the multifidus activation. Next is from Miss Aspia. What is the best duration to perform Pilates? What do you mean by best duration? Whether it is morning or evening or lifetime thing you are asking. So there is no age limits for doing or performing Pilates. Best time to do Pilates or any workouts is definitely in the early hours. If you have any metabolic issues or anything like diabetes or hypertension, you need to choose your timings. That's all. So best duration, even during pregnancy, you can follow Pilates. Even when you are playing sports, you can do Pilates. So these are the best things I understood from your question.
Aspia madam is there in Zoom. If you want to speak, you can unmute your mic. I think she might have want to know the duration, how long you can perform.
Okay,
Yes,
how
ma'am.
long
Maybe.
it's like?
How long we can perform, yes, ma'am.
Yes.
Yeah, how long it's like you can definitely teaching Pilates in the initial stage takes 1/2 50 minutes. For example, 75 minutes to 90 minutes in the beginning stage. So because you are going to teach the principles and they need to accommodate those principles and they need to learn. So once they are well versed with that principles, definitely you can what is it, finish the sessions between 1 hour. So minimum of 60 minutes it takes your session. If it is like problem centric, for example, you are teaching Pilates for your low back pain, definitely few exercises are only you are going to target. For example, 3-4 exercises in your rehab routine. For that, it takes only 20 to 30 minutes. Depends on your plan. That's all. Next question is from Ms. Harsha Visha. Is there any? Yeah. Is there any contraindication for Pilates? There are no great contraindications for your Pilates. Only red flags. That is, during pregnancy, you need to take care of the mother while performing Pilates. So if it is for geriatric lines, you need to prevent their falls. That's all kind of things. There is no such greater contraindications. So fractures, those things are like contraindicated for exercises in the initial stage, acute stage. So those are all common for all the exercises. Next is from our YouTube viewer, Ms. Shruti. Use of this tool is how much used in foreign countries? So if it is cost approximately in the Indian value, it is around complete setup or complete equipment costs around 2 to 3 lakhs. Use of this tool in foreign countries, your question is little confusing. So use of this tool in foreign countries, most of foreigners or most of fitness enthusiasts in Western countries follow Pilates.
I think she might have asked about how much Pilates is being practiced in foreign countries.
Yeah, almost everyone use in the Western countries. In foreign countries, even it is like what is a vague question. Even it is like Western European countries, they use definitely 90% of population. Next is from Ms. Jayasudha. Sir, how to strengthen multifidus alone? Definitely, we cannot strengthen multifidus alone because it's a deep muscle. So you need to get the help of your deep core. So you need to get activated of your deep core with your multifidus. So when you are incorporating multifidus in your regular exercise routine or regular rehab routine, definitely it is going to give you changes. That's what this session is all about. So it is not about strengthening only multifidus. You need to strengthen multifidus along with your other musculatures. That is the main thing we need to do it in our low back rehabilitation or your spinal stability activity. Next is from Mr. Prakash. Pilates can be done in pediatrics and how? Pediatrics, definitely not in the early stage of 3-4 years or less than 5 years. Definitely we cannot do Pilates. Pilates is again mind-body coordination exercise where that pediatric client or the child has to know about the movements or know to feel the movements. For example, pediatric conditions like muscular atrophies or dystrophies or cerebral palsy conditions or anything cannot be incorporated with Pilates. Pilates is for what is a higher level of fitness where you are going to use it. Definitely no for pediatric clients, pediatric conditions. Next is
Any
from
more questions?
Shruti. How do you program your treatment plan for low back pain, including Pilates of 90 minutes? Are you going to use other approaches for the treatment? Good question, Shruti. So, for example, you need to assess before the client, before you're starting your anything, even if it's other treatment or even if it's Pilates, you need to assess them. For example, you are assessing Mr. X. So for that Mr. X, you find in your assessment it's low cross syndrome. Then you need to release or you need to treat that tightness and weakness of that muscles. So once you treat that muscles, then you are going to give progressions to your other activity. For example, Pilates 90-minute session, what I told is for someone who is doing only Pilates for complete duration. So it depends. For example, someone with acute pain, they are coming to me. I treat them with classical therapy like manual therapy or electrotherapy or home remedies or other relaxation techniques, cupping, dry needling, K-taping, any other physiotherapy tools. I use it and then I'll progress it with Pilates. So there is no duration for that. So 90 minutes of session is told for clients those who are coming only for Pilates. Okay. Yeah. Any other questions?
No more questions in YouTube. Any other questions, dear participants? You can post or we would be winding up.
I hope everyone are understood.
I think all would be satisfied with the session. You've answered for all the questions they have posted actually in YouTube and in Zoom. Thank you, Rupesh. You have, even with your hectic schedules, you have agreed to do this program with us.
And we would.
Yes, we understand it actually. And I would like to thank all the participants whoever attending our program from our YouTube channel and in Zoom. And stay in touch with our ExRxIndia and stay tuned to Fitness and Rehab India YouTube channel for our upcoming programs. Thank you all. Thank you, Rupesh. Good night and bye-bye.
Thank you, ma'am. Thank you all.